Hello everyone, welcome to Adul's Pharma Capsule. Imagine a patient arrives in the emergency department after accidentally taking too many tablets, swallowing a poisonous chemical, or being bitten by a venomous snake. In these situations, every second counts. A quick and correct treatment can save the patient's life. One of the most important life-saving treatments is an antidote. In today's session, we will learn about antidotes in a simple and easy to understand way. We will cover definition, indications, mechanism of action, common antidotes, nurses' responsibilities. By the end of this video, you will have a clear understanding of when antidotes are used, how they work, and the important role nurses play in their safe administration. So without any further delay, let's begin with the definition. Definition: an antidote is a substance that prevents, neutralizes, or reverses the harmful effects of a poison or toxic drug. In simple words, an antidote is a medicine that helps protect the body from the harmful effects of a poison. A simple way to remember this is poison causes harm, but an antidote reduces or removes that harm. It is important to remember that not every poison has a specific antidote. In many cases of poisoning, supportive treatments such as maintaining the airway, breathing, circulation, and other supportive care is equally important to help the patient recover. Now that we understand what an antidote is, let's move on to the indications and learn when an antidote is used. Indications: antidotes are given only when there is a clear medical indication. They are not used for every poisoning case. Some common indications include 1. Drug overdose. Antidotes are commonly used in cases of opioid overdose, benzodiazepine overdose, paracetamol overdose. Second, poisoning. They are also used to treat poisoning caused by organophosphate insecticides, cyanide, methanol. Third, snake bite. Anti-snake venom is the antidote used for venomous snake bites. Fourth, heavy metal poisoning. Antidotes are used in poisoning caused by heavy metals such as lead, arsenic, mercury, copper. Fifth, certain chemical exposures. Some toxic chemicals also have specific antidotes depending on the substance involved. A very important point to remember is that the correct antidote should be given only after identify the poison. Giving the wrong antidote may not benefit the patient and, in some cases, can even lead to serious complications. Now that we know when antidotes are used, the next question is how do they work inside our body? Let's move on to the mechanism of action of antidotes. Mechanism of action. Although different antidotes work in different ways, their main goal is the same: to reduce or stop the harmful effects of a poison or toxic drug. There are three common mechanisms of action. First, neutralization. Some antidotes directly bind to the poison or toxin, making it inactive and preventing it from causing further damage. Example: anti-snake venom binds to snake venom toxins and neutralizes their effects. Second, blocking the toxic effect. Some antidotes block the action of the poison at its receptor site, preventing it from producing harmful effects. Example: naloxone blocks opioid receptors and rapidly reverses the effects of an opioid overdose. Third, increasing elimination. Some antidotes helps remove the poison from the body by binding to it, allowing it to be excreted through the urine. Example: chelating agents bind heavy metals such as lead or mercury, helping eliminate them from the body. In simple words, remember this: antidotes work by neutralizing, blocking, or removing toxins from the body. Now that we understand how antidotes work, let's move on to some of the most commonly used antidotes in clinical practice. Common antidotes. Now, let's look at some of the most commonly used antidotes that every nursing student should know. Paracetamol poisoning, N-acetylcysteine. Opioid overdose, naloxone. Benzodiazepine overdose, flumazenil. Organophosphate poisoning, atropine with pralidoxime. Heparin overdose, protamine sulfate. Warfarin toxicity, vitamin K. Methanol poisoning, fomepizole or ethanol. Cyanide poisoning, hydroxycobalamin. Iron poisoning, deferoxamine. Heavy metal poisoning, chelating agents such as CDTA, dimercaprol, or penicillamine, depending on the type of metal involved. A simple tip for students: don't try to memorize all the antidotes at once. Instead, learn one poison and its antidote at a time. With regular revision and clinical practice, remembering them become much easier. Knowing the correct antidote is only one part of the patient care. The nurse plays a vital role in ensuring that the antidote is administered safely, promptly, and effectively. So, let's move on to the nurse's responsibilities. Nurse's responsibilities. Now, let's discuss the important responsibilities of a nurse during antidote administration. 1. Assess the patient. First, assess the patient's airway, breathing, circulation, level of consciousness, and vital signs. This helps identify life-threatening problems that need immediate attention. 2. Identify the poison. Collect a detailed history from the patient or relatives and identify the suspected poison or drug whenever possible. 3. Prepare the antidote. Before administration, verify the correct antidote, correct dose, correct route, and expiry date. Follow the medication safety principles. 4. Administer the antidote safely. Administer the antidote according to the doctor's prescription and the hospital protocol using the correct technique. 5. Monitor the patient. Closely observe the patient for improvement in symptoms and monitor for adverse reactions, allergies, or complications. 6. Provide supportive care. Continue supportive measures such as maintaining the airway, providing oxygen therapy, administering IV fluids, and other treatments as required. 7. Document everything. Accurately record the suspected poison, antidote given, dose, route, time of administration, patient response, and any adverse events. 8. Educate the patient and family. Explain the treatment provided and educate the patient and family about preventing future poisoning and the importance of safe medication and chemical storage. Key message to remember: early recognition, timely administration of the correct antidote, and careful patient monitoring can save a life. Nurses play a vital role in achieving all these. Let's quickly revise what we learned today. An antidote is a substance that prevents, neutralizes, or reverses the harmful effects of a poison or toxic drug. Antidotes are used only in selected cases of poisoning and drug overdose when there is a clear medical indication. They work by neutralizing the poison, blocking its toxic effects, or helping remove it from the body. Some important antidotes to remember are N-acetylcysteine, naloxone, flumazenil, atropine with pralidoxime, vitamin K, protamine sulfate, hydroxycobalamin, deferoxamine, and chelating agents such as CDTA, dimercaprol, and penicillamine. Finally, nurses play a vital role in patient assessment, identifying the poison, preparing and administering the correct antidote safely, monitor the patient's response, providing supportive care, maintaining accurate documentation, and educating patient and family. Remember this one simple message: the right antidote given at the right time with proper nursing care can save a patient's life. Thank you for watching. If you found this video helpful, please like, share and subscribe to Adul's Pharma Capsule for more simple and easy to understand pharmacology videos for nursing students. If you have any questions or suggestions, feel free to leave them in the comments below. See you in the next video. Until then, keep learning and stay safe.